Hello guys, and welcome back to my YouTube channel. Today we are going to discuss an ethical discussion that often comes up in nursing school, and it is the case where a Jehovah's Witness patient is refusing blood. So we are going to talk about why they refuse and what options they have, and a few cases where their decision was overturned in the UK. Alright, let's get into it. So there are two cases that happened recently in the UK where the High Courts decided to overturn the parents' decision to refuse blood for their children. The first case was a 3-week-old baby who did need a blood transfusion. He didn't really give a whole lot of details as far as what was going on with the child, but the courts did overturn the decision to not give blood to the patient. Even though the mother was refusing blood, the courts said the child is going to get blood. He was in imminent danger of having serious complications from not having blood, or he could have died from not having blood. So the courts decided to take the matters into their hands and give the okay to give the transfusion. The second case is a 5-year-old child who was born with sickle cell anemia. So let's talk about sickle cell anemia for a minute. That is a condition where the red blood cells that are normally shaped like little discs are shaped like crescent moons or sickles, which is where the name comes from. These red blood cells cannot carry oxygen as well as a normal red blood cell, obviously because of the shape. There's not enough surface area for the oxygen to stick to. This causes, along with anemia, it causes fatigue, low oxygen in the blood system, and extreme amounts of pain when there is a flare-up. So how is this condition treated? Most often it's when the patient is in crisis, when there's a flare-up. Pain control is number one because they're in extreme pain. These little sickles, red blood cells, are pointy as you can see, and they pretty much just tear up everything they touch. Very painful for the patient. This condition is extremely painful. And it's very hard for us to take care of as a nurse because there's really nothing we can do. Oftentimes, we're giving pain meds, and they may even have a patient-controlled analgesia pump. So it's something that's constantly connected to them, and they can push it every time they need it, and it's a set amount of dose and set amount of dose per hour. So they can only push it so many times and get that dose so many times, but it'll help them to be able to control their pain better and not have to wait on the nurse. So that's an option for them. Also, there are forms of chemotherapy that are used to treat the cells that are producing the sickle cells, to try to stop them from producing those. Some people use this treatment, some don't. It really just depends on the severity of their condition. Taking in a proper amount of vitamins can help you control your normal functions in your body. Many like B vitamins and things like that can help just maintain your metabolism and everything, because your red blood cells obviously help in every facet of your body, so when there's not as many good ones, things have a harder time functioning. And the last treatment for sickle cell anemia is blood transfusions, because what better way to treat a lack of good red blood cells than to add some good red blood cells? Makes sense to me. I don't know. So this 5-year-old child was in desperate need of a transfusion because her count was so low, and she was at serious risk for a stroke and not being able to clot and things like that. So the court system overturned the parents' decision to refuse the transfusion, so the child did end up receiving the transfusion. But the real question is, why do they refuse blood in the very first place? Why is this one of their big things? So in their religion, they refuse blood because they believe that blood is the life force and God is the creator of life. So if they refuse the blood, they are refusing it out of respect for God as the creator of life and out of obedience to Him. So that's their reasoning. Also, they choose not to assume the risk of developing a bloodborne illness from getting a transfusion. So bloodborne illnesses, they're referring to like Hep C, HIV, things like that, those big ones that people are real afraid of. So when someone donates blood, what happens to the blood that they donate? And if you ask the CDC, if you live in America, the Center for Disease Control will tell you right on their website how blood transfusions and blood donations are monitored. So if someone donates blood, that blood is automatically tested for the following conditions: hepatitis B, hepatitis C, HIV 1 and 2, human T lymphotropic virus, syphilis, West Nile, and Zika. So all of those conditions are automatically tested on every person who donates, no matter what. Obviously, if any of them were to be contaminated, they would not give them to a patient. Pretty straightforward. If a patient is donating platelets, then they'll be tested for bacterial contamination in that case, because when you give platelets, it is filtered in a certain way, so they're making sure their contamination is not happening. When a first-time donor is giving blood, they are also tested for Trypanosoma cruzi, which is a different type of virus. That one is automatically tested on the first donation. And the Babesia virus is also tested on donors that come from an area where that virus is prominent. In cases where the recipient has some special concerns, they also test for cytomegalovirus in the donor. So as you can see, any donor's blood is sent through thorough testing before it is sent off to be given to patients. And when a person is going to get a transfusion, they are type and screened 3 different times, and then the person who is preparing the blood in the lab type and screens the blood that they're giving them. The person who picks up the blood goes over all of that with the tech, and then 2 nurses will sign off that and go over that everything matches to the patient, to the blood type, to what's brought up in the bag, to what's on the label, to the blood type of the patient, all of that before it's given to the patient. So there's many stops before it gets to the actual patient. So the risk of having a bloodborne illness is very low. You can have a reaction to blood just based on especially if you never had a transfusion before, your body can react to the new cells and think that they're, wrong and attack them. That is a very rare instance, but it can happen. In most hospitals, depending on the policy, the nurse has to stay with the patient for so long after the transfusion is started so that it can be, monitored in case any reactions were to happen. But it's really unlikely, and it's also extremely unlikely to develop any kind of bloodborne illness from a transfusion. So I understand that they don't want to assume this risk, but it's so low. It's just so low, and the risk of like this young girl who has sickle cell of having a stroke because her numbers are so low, that is a high risk. That is an extremely high risk. So, I mean, if it were me, I don't think I'd let anything come between saving my child. Literally, until the very last option was exhausted before I were to say, to not pursue any more treatment. So that's just my opinion. But as nurses, we can't give our opinion. We just have to treat the patient with as much respect and dignity as we can. But this is a very confusing topic, especially for a lot of nurses who just don't understand this particular religion. As much as I want to respect the religion, I don't understand it and I don't agree with it, but it's not my job to agree or disagree with the patient's choices. It's my job to advocate for them to be able to have these choices. So that is what happens when you are a Jehovah's Witness and you need a blood transfusion. You either refuse it or the court will take over and give it to you anyway. Do you agree with the court system taking over and giving blood to these 2 patients? Let me know down below. I'd love to hear from you. And if you would not mind, please defibrillate my subscribe button with 200 joules. I would really appreciate that. And if you could swing by and start CPR on the like button, that would really help me out. And I will see you guys in the next one. Bye.